Taking back your active Florida lifestyle is now even easier with another brand of new Pain Relief Center, which is now open. Dr. Hector Casas from Pain Relief Centers joins us to tell us more. New location, new exciting things, but the bottom line, you are still out there helping people. How are you today?
Good morning. How are you? Good to see you again.
Good to see you too. I'm excited you're here, and I just kind of touched on the brand new location there, so let's dive right in. You're helping people all over the Bay Area.
All over the Bay Area, we have several offices, but my particular office is in Sun City here in Florida.
And when it comes down to offices, this is one thing that really caught my attention today. You can even get same-day appointments. Why is that so important?
Absolutely, because we can't have people are in pain. They need to get in to see us as soon as possible. So we try to strive to get people in very quickly. You call our numbers, and we'll get you in the same day if you need that.
And Dr. Casas, you've been here before and we've chatted before, but just so people know, if you are at home in pain, when is it time to pick up the phone? What do you recommend for people that are like, oh, my pain's not that bad versus like, yes, I need to be seen today?
That is a great question. You know, when pain starts interfering with your daily activities, your quality of life, your mood, you start getting depressed, not getting out of bed, that's time to give us a call.
And those are some good examples, and hopefully not many people are experiencing that, but if you are, of course, you can call today. What are some of the complaints you see?
We see a whole range of complaints ranging from neck pain, lower back pain, to joint pain, shoulders, knees, hips, foot pain, just about every kind of pain out there.
I was going to say, there's no one type of pain that you treat versus others that people may experience.
We do a lot of spine pain and joint pain mostly.
Mostly
neck
those
and lower
two.
back are the most common things we see every day.
Well, you know, I've got to ask about treatment options. How are you
Yes.
able to help?
Well, we have a whole host of treatment options from, we really firmly believe in conservative therapy at the beginning with physical therapy, weight loss, lifestyle changes, dieting, exercise, and if that's not enough, then we do the interventional procedures. We have a whole host of procedures that range from epidural steroid injections to spinal cord stimulators to intrathecal opiate pumps. Just a whole host of stuff that we can do to help our patients.
But it sounds like you don't necessarily start off with the most invasive, which I think is interesting.
That is correct.
And I think that's got to ease some people, because I mean, sometimes if you're thinking about seeing a new doctor, it can be intimidating.
Of course it is, yes.
And talk about how important it is for you, though, to get to know the patients, because you just listed all the people that you are able to help out there. I'm assuming each patient does have to be treated as the individual that they are.
Absolutely. Each case is so individual. You have to individualize care, and that's where the expertise comes in. I mean, we don't do cookie cutter treatments for everybody. So everybody has their own host of issues and nuances that we have to take into consideration.
And that's where, again, this new location, you're able to help people if they want to stay close to home in a whole new area.
Absolutely.
You know, sometimes maybe you've seen on television different pain relief centers that do pop up around the area. How do you differ?
We differ because we take an individualized approach, and we do care. I mean, we get to know our patients, their stories, they get to know us, and so it's a symbiotic relationship that it lasts many years.
Say someone's watching at home right now, and again, they're just a little intimidated or a little concerned to pick up the phone and give you a call today. What would you like to say to that person?
The most important thing is that our practices are state-of-the-art practices. We're all trained, board-certified doctors trained in pain management. Our first go-to is not your pain pills. So people are very hesitant to come in to see us because they think of pill mills out there. We're definitely not that. And when they come in, they say, hey, this is different than what I thought it would be. And they're very happy about it.
You know, so many times too, in chatting with you before, I'm continuing to learn things. One of the things too, workers' comp. That's a big deal that you're able to treat.
Absolutely. We treat workers' comp from all over the country. We have people coming from Ohio, from New York, who've settled down here in Florida. We also do personal injury as well. So.
Why is it important for you to be able to take on all of these different situations?
It's important because at the end of the day, we use our same set of skills to treat a whole host of conditions. It doesn't matter who the insurance company is. A patient is a patient, and we're here for them.
I like it. Dr. Casas, it's always so good to see you.
It's my pleasure to be here again.
Maybe you are at home and thinking about picking up the phone and giving them a call today. Well, of course, we want to share with you their website, share their phone number, and again, that new location right there in Sun City. It is a treat to have you here. Hopefully you continue to help more people in the Bay Area.